Bismillahirrahmanirrahim. Assalamu alaikum. I welcome you all to my YouTube video channel Comprehensive Pharmacognosy Review. Today's topic under discussion is Pharmacology Multiple Choice Questions. But before that, hi everyone, I am Tariq Sultan. Question number 1. One effect that theophylline, nitroglycerin, isoproterenol and histamine have in common is A. Direct stimulation of cardiac contractile force. B. Tachycardia. C. Increased gastric acid secretion. D. Postural hypotension. E. Throbbing headache. The answer is B. Explanation. Theophylline does not cause headache. Nitroglycerin does not cause gastric acid secretion. Isoproterenol does not cause either. Histamine may cause all of the effects listed. Question 2. A 23-year-old woman is using a terbutaline inhaler for frequent acute episodes of asthma and describes symptoms that she ascribes to the terbutaline. Which of the following is not a recognized action of terbutaline? A. Diuretic effect. B. Positive inotropic effect. C. Skeletal muscle tremor. D. Smooth muscle relaxation. E. Tachycardia. The answer is A. Explanation. Terbutaline is a selective beta-2 receptor agonist, but in moderate to high doses it includes beta-1 cardiac effects as well as beta-2 mediated smooth and skeletal muscle effects. Question 3. A 10-year-old child has severe asthma and was hospitalized 5 times between the ages of 7 and 9. He is now receiving outpatient medications that have greatly reduced the frequency of severe attacks. Which of the following is most likely to have adverse effects when used daily over long periods for severe asthma? A. Albuterol by aerosol. B. Beclomethasone by aerosol. C. Cromolyn by inhaler. D. Prednisone by mouth. E. Theophylline in long-acting oral form. The answer is D. Explanation. If oral corticosteroids must be used, alternate day therapy is preferred because it interferes less with normal growth in children. Question 4. Cromolyn has as its major action A. Block of calcium channels in lymphocytes. B. Block of mediator release from mast cells. C. Block of phosphodiesterase in mast cells and basophils. D. Smooth muscle relaxation in the bronchi. E. Stimulation of cortisol released by the adrenals. The answer is B. Explanation. Inhibition of mediator release from mast cells. The mechanism for this effect is not known. A 16-year-old patient is in the emergency room receiving nasal oxygen. She has a heart rate of 135 per minute, a respiratory rate of 40 per minute, and a peak expiratory flow PEF less than 50% of the predicted value. Wheezing and rales are audible without a stethoscope. Question 5. Drugs that can dilate bronchi during an acute asthmatic attack include all the following except A. Epinephrine, B. Terbutaline, C. Nedochromal, D. Theophylline, E. Ipratropium. The answer is C. Explanation. Neither nedochromal nor chromalin is capable of reversing bronchospasm. Their action is prophylactic. Question 6. After successful treatment of the acute attack, the patient was referred to the outpatient clinic for follow-up treatment of her asthma. Successful strategies currently in use for asthma include all the following except A. Avoidance of antigen exposure, B. Blockade of histamine receptors, C. Blockade of leukotriene receptors, D. Inhibition of phospholipase A2, E. Inhibition of release of mediators from mast cells and leukocytes. The answer is B. Explanation. Histamine does not appear to play a significant role in asthma, and antihistaminic drugs, even in high doses, are of little or no value. Question 7. Mr. Green is a 60-year-old former smoker with severe chronic obstructive pulmonary disease, that is COPD, and cardiac disease associated with frequent episodes of bronchospasm. Which of the following is a bronchodilator useful in COPD and least likely to cause cardiac arrhythmia? A. Aminophylline, B. Chromalin, C. Epinephrine, D. Ipratropium, E. Metoprolol, F. Metoprolol, G. Prednisone or prednisolone, H. Salmeterol, I. Zafirleucast, J. Xylutone. The answer is D. Explanation. Ipratropium is the bronchodilator that is most likely to be useful in COPD without causing arrhythmias. Question 8. Which of the following is a non-selective but very potent and efficacious bronchodilator that is not active by the oral route? A. Aminophylline, B. Chromalin, C. Epinephrine, D. Ipratropium, E. Metoprolol, F. Metoprolol, G. Prednisone or prednisolone, H. Salmeterol, I. Zafirleucast, J. Xylutone. The answer is C. Explanation: epinephrine is still one of the most potent and efficacious agents available for asthma. However, because it is non-selective, beta-2 selective agents are preferred. Question 9. Which of the following is a prophylactic agent that appears to stabilize mast cells? A. Aminophylline, B. Cromolyn, C. Epinephrine, D. Ipratropium, E. Metoprolol, F. Metoprolol, G. Prednisone or prednisolone, H. Salmeterol, I. Zafirlukast, J. Xyluten. The answer is B. Explanation: Cromolyn is useful only for prophylaxis. The drug stabilizes mast cells, that is, prevents mediator release. Question 10. Which of the following is a direct bronchodilator that is most often used in asthma by the oral route? A. Aminophylline, B. Cromolyn, C. Epinephrine, D. Ipratropium, E. Metoprolol, F. Metoprolol, G. Prednisone or prednisolone, H. Salmeterol, I. Zafirlukast, J. Xyluten. The answer is A. Explanation: aminophylline, a salt of theophylline, is a bronchodilator that is active by the oral route. Question 11. Which of the following in its parenteral form is life-saving in severe status asthmaticus and acts at least in part by inhibiting phospholipase A2? A. Aminophylline, B. Cromolyn, C. Epinephrine, D. Ipratropium, E. Metoprolol, F. Metoprolol, G. Prednisone or prednisolone, H. Salmeterol, I. Zafirlukast, J. Xyluten. The answer is G. Explanation: parenteral corticosteroids such as prednisolone are life-saving in status asthmaticus. They probably act by reducing production of leukotrienes. Question 12. Which of the following has overdose toxicity that includes insomnia, arrhythmias and convulsions? A. Aminophylline, B. Cromolyn, C. Epinephrine, D. Ipratropium, E. Metoprolol, F. Metoprolol, G. Prednisone or prednisolone, H. Salmeterol, I. Zafirlukast, J. Xyluten. The answer is A. Explanation: aminophylline is a salt of theophylline like the base theophylline. Aminophylline can cause severe and potentially lethal overdose toxicity. Question 13. Which of the following is a very long-acting beta-2 selective agonist that is used for asthma prophylaxis? A. Aminophyllin, B. Cromolyn, C. Epinephrine, D. Ipratropium, E. Metoprolol, F. Metoprolol, G. Prednisone or prednisolone, H. Salmeterol, I. Zafirlukast, J. Xyleuton. The answer is H. Explanation. Salmeterol is a long-acting beta-2 selective sympathomimetic agent that is approved for prophylactic use in asthma. Question 14. A drug that directly inhibits 5-lipoxygenase and reduces leukotriene synthesis. Select the one lettered option that is most closely associated with it. Each lettered option may be selected once, more than once, or not at all. A. Aminophyllin, B. Cromolyn, C. Epinephrine, D. Ipratropium, E. Metoprolol, F. Metoprolol, G. Prednisone or prednisolone, H. Salmeterol, I. Zafirlukast, J. Xyleuton. The answer is J. Explanation. Xyleuton is a selective inhibitor of 5-lipoxygenase. Question 15. Inhibitor of LTD4 receptors. A. Aminophyllin, B. Cromolyn, C. Epinephrine, D. Ipratropium, E. Metoprolol, F. Metoprolol, G. Prednisone or prednisolone, H. Salmeterol, I. Zafirlukast, J. Xyleuton. The answer is I. Explanation. Zafirlukast inhibits LTD4 at its receptors. I hope you have enjoyed this video. Thank you for watching. It's bye for now.